Now moving on to our second section, that is the joint replacement surgeries or orthoplasties. In this, we will briefly discussing again what is partial and total joint replacements, what is a microsurgery and joint transplantation, and what is joint replantation, which is another very important concept which has now come and especially in case of massive trauma in which there is actually a whole, either a partial or complete limb is actually lacerated or cut off from the body. There are certain indications in which we can replant them. So what is partial replacement? As I told you, if you take the example of the knee joint, so what happens in some cases, there is actually increased genu varum, or that is bowed legs, or increased genu valgum, that is the knocked knees. In this, on the medial or on the lateral femoral condyle, there is increased actually a loading of the body weight during normal gait cycles or walking, climbing stairs, or coming down from the stairs. As a result, the one of the condyle, either the medial or the lateral, actually results in increase there is increased osteoarthritis of the one side of the femur or one condyle of the femur. So if the patient is young and fulfills the criteria of unicondylar knee replacements, instead of giving it a whole knee, total knee in which both the condyles are actually replaced, we can only replace one of the condyle which is actually affected most, and it actually gives us, it's helpful that after 5 to 7 years or 10 years, we can convert this unicondylar knee into total knee replacements. So actually it gives total knee replacements a more longevity or life. So that is actually causing the replacement of one of the articulating part or one compartment of the joint, either the medial or the lateral. And usually prosthesis is kept in position by an acrylic cement or polymethyl methacrylate cement. Or initially press fit stability was advocated as well, but now usually you need some degree of cement, so that because it's more close to the normal knee, although ligaments of the knee are preserved, especially the ACL and PCL. So yes, we can use press fit as well, but usually the cement is actually used. Bonding is at the molecular level between the implant and the bone, that is ingrowth or by on-growth mechanisms. Now coming to the total joint replacement. Total joint replacement means replacing the whole of the joint. That is, the both articulating parts are replaced. Use of prosthetic implants are actually utilized. And bearings is hard on soft or hard on hard materials. So what does this mean? Hard on hard and hard on soft. For example, if you see this over here, now this is on average, you can say a total hip replacement construct. This is the femoral component. This is the acetabular component. This is polyethylene, which is actually ultra high molecular weight polyethylene. If you press fit it in this way, that this head articulates with polyethylene, this polyethylene articulates with the acetabular cup. So this is basically hard and soft articulation. But instead of having, if you do not have in the initially when the reconstructs were there, this was Charles' reconstruction method, in which this head was very small and there was no polyethylene to articulate with. Now the small metal head actually articulated with the metal acetabular cup. This was metal on metal bearing initially. This is actually hard on hard bearing combination, but usually now we have actually hard and soft bearing used, so that actually it reduces the corrosiveness and actually gives implant a larger life. Joint replacement articulation could be with our articulation produced wears, whatever, even if it's hard and hard or hard and soft, definitely some degree of wear and tear will occur as the joint will undergo the cyclic loading. And this wear produces roughening of the surfaces, and usually metal and metal bearings were initially used, but nowadays they are divided. Now they are actually metal and poly. That is, the poly is used on the metal, and this poly also articulates with acetabulum. So it has metal and poly rather than metal on metal articulations. Now metal on metal is actually kind of a band because they had a very high wear rate. So rarely been used world over practice. We now use the most common is actually the metal on poly. Now coming to the microsurgery. These are used in repairing nerves and vessel, transplanting bone or soft tissues with vascular pedicle, transferring less excisional digit to replace the lost essential one, or reattaching several limb or digit. Actually, it's more of a domain of a plastic surgery, but it involves a lot of plastic surgeons in work actually. For example, if we are dealing with AVN of the hip, And in my previous lectures, if you would know that in AV and hip, one of the method was use of free vascularized fibrillary graft. In this, what it does is actually take the bone with along with intact nerve supply and as it transplant it back into the head of the femur. This is kind of a mechanism of use of microsurgery. Other option is, for example, there was a limb which was actually cut due to trauma, and if they reimplant that, is actually anastomosis, the artery with the arteries, the veins with vein, and the tendons and nerves and all that is actually a domain of microsurgery. And sometimes the surgery can be very extensive surgeries as well. These requirements include an operating microscopes and instruments, microsutures, which actually they need to have a specialist lenses, chairs with arm support, because these surgeries may actually last up to 8 to 10 hours at times. And surgeons, usually you need a special type of plastic surgeons, or those surgeons that are actually expertise of microsurgery, or they have an experience of microsurgery as well. Now coming to the limb transplantation. This could be severed part could be kept cool during transport. Why? Because it actually increases the cold-blooded time, or that is the it actually enhances that it's going to decrease the degeneration of the body parts. If reperfusion is, then severe systemic upset may be. For example, if this is what happens, if the patient had a trauma or his or her arm just chopped off due to this trauma, no, if this has to be replanted. The way we can replant this is then that has a mechanism that you first of all you fix the bone. That is, it's a simple mnemonic is B fan of B. That is bone first, then comes the extensor tendon, then comes the flexor tendon, then artery, then nerve, and lastly you anastomose the vein. With suturing of the vessels, the nerves, the tendons that I just told you, and in this correct fashion, that is the bone first, you fix that by external fixator, then you go for extensor tendon suturing. After that, you suture the flexor tendons, then you go for arterial repair, then venous, so then a nerve, and then lastly the venous perfusion is actually restored. Then decompression of skin and fascia, because this usually reperfusion actually can produce compartment syndrome. That is very important to not to turn all your hard work into a disaster by end result. Even if the end result is compartment syndrome, then thrombectomy may be required, because sometimes there may be a thrombosis at the anastomosis site. So yes, that is important, that we have to not only do the surgery, and after the surgery the patient should be monitored for any vascular disaster which can, for example, there may be an anastomotic leak, and there may be thrombus occluding a major artery. More muscle is amputated, and the amputated part shorter the lasting period, because that is important. If the bulky muscles are there, they can be easily handled. But if there was very small muscles, they already had a very severe blood supply, then they would result in necrosis early. Limb transplantation is an intensive long-term immunotherapy is also required, because sometimes if this was allograft was used, if someone else's limb was actually used to transplant on another person, that you actually need long-term immunotherapy to actually stop graft rejection. Hand transplantation techniques have been developed, and hand transplants are being very readily done in US and European countries. Cadaveric hand can be used as a sensate functional limb. Issues actually is availability of the donors. Not every patient presents with and not they readily donate their hands for somebody's. In this section, we have briefly gone through what are the different types of orthoplasties and what is the brief concept of microsurgery. As you know, transplanting partially replacing the joints such as unicondylar knee arthroplasty is under the banner of partial knee replacements. Total knee replacement means converting both the femoral condyles and tibial condyles into a prosthetic fit. And then we have briefly gone through the microsurgery. As you know, microsurgery is an extensive procedure and requires a lot of expertise. But usually, if a patient limbs comes with which is chopped off due to trauma, then we can fix the bone first, then the extensor tendon, then the flexor tendons, then the arteries, then lastly the nerves, and lastly the veins. Keep watching sqadia.com. Thank you very much.